Let's talk about CBT for OCD. CBT is commonly used in treating OCD. So in this audio, I wanted to go over with you what it is and how it can help you overcome your OCD. CBT stands for Cognitive Behavioral Therapy. The best way to show you how CBT is used to overcome OCD is probably to give you an example. So let's take an example of a person who has fear of germs. And they're afraid to touch doorknobs because they're afraid that they're going to get some sort of a disease if they touch a doorknob. So if this person uses CBT in order to overcome OCD, what they would do is create a hierarchy list of things that scare them, from the most scariest to the least scariest. And as their life goes on and as they go about their daily things, what they would do is incorporate the least scariest situation into their daily life. And they would do this continuously until the situation stopped being scary at all. So if, say, the least scariest situation was giving them a level of anxiety that's, say, 1 out of 10. So the least level of anxiety possible, but there was still anxiety there. The doctor, or if the person is doing it on their own, they would have to monitor to make sure that that level of anxiety goes to nothing. So it's not scary to them at all. And once it's not scary at all, what they would do is they would move on to the next item on the list. So basically, they're slowly conquering their fears one by one, and they're doing it gradually so they don't freak out, they don't have a complete breakdown. They're doing it slowly so they don't see that it's like very, very scary to them. They're doing it progressively. And that's how CBT is basically done. Now, let's talk about some of the problems with CBT. The biggest thing with CBT that I find to be very problematic when it comes to dealing with OCD is that OCD does tend to switch a lot. So for example, today the person is afraid of, driving, for example. They're afraid that if they drive, they'll drive over somebody and they won't know, but then they'll find out later and then they'll go to jail or something like that. This is a very, very common OCD obsession. So I'm just kind of using it as an example. But that doesn't mean that that obsession is going to stick around for the rest of their life. So maybe a year from now, their mind switches to something else. And that could be because of a number of factors. So the problem with CBT is that once you overcome your obsession, which you will, that it does work for that. But once you overcome that particular obsession, it's not the same thing as overcoming OCD, where we're not using the particular obsession as a measure to see how good or bad your OCD is overall. It's the thoughts in general, it's the fact that they're generally bothering you, that's the problem, not the particular thought that you're experiencing in this moment in time. So I find that the best way it's a good thing to do the CBT, but when you do it, if you're in the position where you're thinking about possibly doing CBT, it's a good thing to do, but just make sure that when you are doing it, once you overcome your obsession, know that another obsession can come very, very easily, and then when it does, you need to stop it before it takes root, before it gets to a problem where you can't deal with it and you have to start CBT all over again. So don't let something else start up like this obsession that you're currently dealing with start it up. And if you do it that way, and if you learn enough about OCD where you can't be fooled or tricked into getting to, this level of anxiety again, then CBT will work very well for you. Like I said, it is a gold standard of OCD therapy right now, and I always welcome OCD therapy because I find that a lot of doctors do rely on medication too much and they're not doing enough therapy altogether. So any kind of therapy is good therapy, but CBT is very, very productive, but just make sure you're doing it correct and make sure you're doing it with a specialist who knows what they're talking about. So because CBT is used for other types of mental disorders, mental illnesses, and it's not the same thing. So make sure that the specialist that you're seeing has done CBT for OCD and has done it successfully. If you have any questions for me about CBT or about anything else, please email me at info@youhaveocd.com. I answer all of the emails. It might not be right away, but I do answer them. Thank you for listening. If you like this video, please click the thumbs up button and don't forget to subscribe.